If you're dealing with pelvic floor dysfunction, there's a good chance you've already tried the standard treatments and maybe didn't get the results you were hoping for. That's often when people start looking into alternative options. In this video, I'll go through a range of alternative treatment options people look into. Some of these are still experimental, with limited research and mostly anecdotal results. And before we get into it, I'll also mention that there's another approach we'll come back to at the end of the video: shockwave therapy and EMTT. Shockwave therapy uses acoustic waves that are applied to the affected area. EMTT, extracorporeal magnetotransduction therapy, uses electromagnetic pulses instead. Both aim to stimulate tissue, improve blood flow, and reduce muscle tension. The idea is that this can help reset irritated areas and promote healing. Some people report improvements, especially in muscle-related pain. But research is still limited, and results can vary quite a bit. Neuromodulation. Neuromodulation involves influencing the nerves that control the bladder and pelvic region. This can be done through sacral nerve stimulation or less invasive methods like tibial nerve stimulation. The goal is to regulate nerve signals and reduce symptoms like urgency, frequency, or pain. For some people, this can help improve symptom control. But again, it's not a guaranteed solution, and it tends to manage symptoms rather than address underlying causes. Acupuncture. Acupuncture is a traditional practice where thin needles are inserted into specific points on the body. It's thought to influence the nervous system, improve circulation, and reduce tension. Some people find it relaxing and notice temporary symptom relief. But the evidence is mixed, and results often depend on the individual. Hypnotherapy. Hypnotherapy focuses on guiding the mind into a deeply relaxed state where patterns of thought and response can be influenced. The idea is that by changing how the brain processes signals from the body, symptoms may become less intense. This approach is more directly connected to the mind-body connection. Some people report good results, especially when stress or anxiety is a major factor. But like the others, it doesn't work for everyone. Botox. Botox injections are sometimes used to relax tight pelvic floor muscles. The idea is to temporarily reduce muscle tension by blocking nerve signals to the muscle. In some cases, this can provide relief, but it's important to understand that this is a more invasive option. It can come with risks and side effects, and the effects are temporary. So it's something that should be carefully considered before trying. All of these treatments can be worth exploring, and for some people, they may provide relief or help manage symptoms. But it's unlikely that any single one of them will fully resolve the condition on its own. One reason for that is that more recent research and many recovery stories point to something deeper. The brain and nervous system often play a significant role in keeping symptoms going. That's why many people who recover don't just rely on physical treatments. They also make psychological changes, reduce fear and anxiety, and work on calming the nervous system. Approaches like pain reprocessing therapy are built around this idea. So if you've been trying different treatments without lasting success, it may be worth looking in that direction as well. Because while there may not be a quick fix, recovery is still possible. I used to struggle with pelvic pain and constant urgency too. So I built Senavita to help others recover. Senavita includes psychological support using pain reprocessing and metacognitive therapy, guided stretches to relax the pelvic floor, expressive journaling to release built-up emotions, my recovery story and practical lessons for daily life, visualization meditations to calm your nervous system and ease symptoms. Track your symptoms, take assessments, and explore a full library of recovery resources. Download Senavita today and start your recovery.